students, here we are continuing on our study of the complications of diabetes. The complications of diabetes. This time we're going to look at foot complications. Foot complications. Well, let's talk about some of the complications that can occur with the foot. First, we can divide it into two causes, if you will. Neuropathy and impaired circulation. Neuropathy involving the nervous system. Impaired circulation involving the circulation. Okay, so let's start with neuropathy. Let's talk about what's characteristic about neuropathy. Well, first of all, we want to make sure that it's neuropathy and not impaired circulation. So, if the patient has good pedal pulses, right here, warm and pink, warm skin, and it looks pink, it tells us that they have good circulation. But if they start to complain of funny feelings in their foot or lacks pain, then we know it's pointing to neuropathy. Okay. Nobody likes pain, but it's a very dangerous thing when you can't feel pain that you need to feel. Let's go to impaired circulation. Impaired circulation. Well, impaired circulation, how do we know they have impaired circulation? Some of the telltale signs will be over here. Their foot feels cold. Their foot feels cold. Remember, blood is warm. And where there is blood, there is warmth. Now, supposing you raise the patient's foot up, what happens to the person with impaired circulation? It starts to turn pale. Less blood is getting in there. Less blood is getting to the foot. Then you put the foot down and it turns red. It's easier for blood to go down than it is to go up. Also, we know that diminished pedal pulses. If they have diminished pedal pulses, you start to palpate the pulse and you say, boy, that feels very thready. Guess what? Could indicate impaired circulation. Now, if they have all these problems with the circulation, but they have normal sensations, hot, cold, whatever, pain, then it's limited to impaired circulation. It doesn't have the neuropathic component. Let's go back to what we said. Two issues, neuropathy, impaired circulation. Now, sometimes you're kind of unlucky and you have them both. Here and here. Both neuropathic problems and impaired circulation. It can be both the cause of the foot complications. Let's go to neuropathic foot ulcers, etiology, or as we know, the causes. Our text just tells us that there's three causes. One is chemical, two is thermal, three is mechanical. Mechanical, thermal, chemical. Chemical, that's for those people that maybe they have some corns and they decide to handle it on their own, buy some over-the-counter material that has salicylic acid. That can cause a foot ulcer. How about thermal problems? Thermal problems, you use a hot water bottle, you're cold at night, you want that warm, but you don't realize that your foot is burning. Uh-oh. You get too close to the fire. Uh-oh. I call this heat proximity. You're too close to the heat and the heat's too hot, tissue damage, foot ulcer. So, chemical, thermal. Lastly, mechanical. Oh, you need to have a good pair of shoes. You need to have good socks. But improper shoe lining can cause a mechanical injury. How about nail cutting? If anyone needs to know how to cut nails, it's the diabetic. They have to cut it straight. We're going to get into that a little bit later. And also the removal of calluses. You don't manage your calluses properly, and you end up with mechanical injury. Okay, clinical, thermal, mechanical are causes of neuropathic foot ulcers. Let's get to some facts that are not going to be very pleasant, but we need to know. Here we have our skull and crossbone. Amputations. Up to 25% of diabetics develop foot ulcers. Alright, up to 25% of diabetics develop foot ulcers. This according to the Journal American Medical Association 2005. More than one-half of all foot ulcers will become infected, requiring hospitalization. More than half of all foot ulcers will become infected, requiring hospitalization. 1 in 5 will need amputation. And we'll cite the source again. Another source there. Diabetes accounts for 80% of the 120,000 non-traumatic amputations. So, 8 out of 10 people who are in a hospital scheduled for non-traumatic amputation, they're probably a diabetic. Worldwide, it is said that every 30 seconds someone is having a limb removed due to diabetes worldwide. And we're talking about some pretty serious stuff. Now, supposing you have a leg amputated or below the knee amputation due to diabetes, you have a 50% chance of having the other limb having to be amputated within 2 years. With that in mind, I want us to close on a happy note. In our next lesson, we're going to discuss ways to prevent this. Education. So, thank you for listening.